This is Safari Blend Sunday. Every week, we make it a point to bring you a topic that we discuss while listening to good high life music. Today, we have the pleasure of talking to Dr. Jemima Kankam. Dr. Kankam attended the University of Ghana Medical School, Kolebu. She's also a board-certified psychiatrist, University of Maryland Medical System. Dr. Kankam is the Medical Director, Outpatient Behavior Services, MedStar Harbor Hospital, Baltimore, Maryland. She's also a Distinguished Life Fellow, American Psychiatric Association. Dr. Jemima Kankam is willing to share her knowledge and expertise, and she is here with Esenam Abra Drah. Esenam is talking to us out of Accra, Ghana. She's a mental health advocate with a lived experience. Now, we are so honored to have you, ladies. You're welcome to Mustbe5radio.
Thank you very much. Thank you so much.
You're welcome. We're going to start. Dr. Kankam, can you hear me?
Yes, thank you. Thank you very much.
Okay, you're welcome. So today we're talking about mental health. We don't always understand some of these topics, so we bring in a professional to explain mental health or whatever topic that we choose. Now, when we say mental health, what is mental health? Okay. And this is for Dr. Kankam.
Yes, so thank you for having both of us on the show. But I want to especially thank Esenam for coming on. Esenam is one of a group of intelligent, dynamic, dedicated Ghanaian young men and women who are using their lived experience with various mental illnesses to educate the public. I met her when she was still at University of Ghana, and I've watched her grow. She works with several NGOs, and you can actually catch her YouTube mental health quarters. I watch it more times than she knows. That explains what it is, because there's too much of superstition when it comes to mental health. So right. Thank you. And I have to say to parents out there, I also am inspired by her parents who went from not understanding to being so supportive because they have educated themselves. So thank you, Esenam. Now, mental health. When we say mental health, we really referring to a mental health system. Okay. There are about a dozen health systems in our body. And some of them are very well known to the public, like cardiovascular health system, cardio as some refer to it in Ghana, and a respiratory health system, which thanks to COVID, the whole world has been educated about. So the mental health system is one of those. Each one of the health systems has a specific task. We know the task of the cardiovascular system, get oxygen to the brain. We know the task of the respiratory system, bring the oxygen into the heart.
Right.
The task of the mental health system is not just about feelings. It's about making decisions, forming opinions, and making decisions that help us in our well-being, help us to adapt to stressful situations, help us relate to other human beings, because the human being wasn't made to be in isolation. And in those three things that helps us function. So how does it do that? So as a child grows, as the intellectual system is developing, okay, that gets us facts. The child knows names, you have the ability. There's right. Also this system, which is highly influenced by where we grew and our culture. By the time we get to adulthood, there are four major groupings of opinions. Okay. Situations or things that are desirable, full of hope, And we get them, say a child is growing, they do something, and you clap. Hey, good. They're beginning to get memory of when I do these things, it brings good. They feel good by the response.
Okay.
So they attach certain situations to a good, desirable things, and that helps to do more of that.
Okay.
In the same way, when it's stop, don't do this, punishment, you begin to attach. So the 4 groups are things that are optimistic, things that will be regret and painful, things that will cause danger, expectation of danger and fear. And the last one are things that challenge our integrity. Okay. So over time, over and over, if our brain remembers those situations and begin to associate other things with those 4 groups. Now, each of those 4 groups is expressed in a certain feeling. And you can guess the optimistic, joy. Things that are regretful, sad feeling or unhappy. The danger or fear is the anxious. And lastly, if you feel challenged to your integrity, it's anger. And then we express those physically. But again, that's highly influenced. My joy may be expressed in laughing loudly, another person calm, but we both have joy.
Okay.
Same thing with the anxious, all 4 emotions. What does that mean? Already that you can't see my mental health because you can't read my mind and you can't see my feeling.
Right.
And even the physical, the physical, the way I express, you can't go back and say it's because I'm happy. That's just a guess. Now, when it is working, what makes it normal, abnormal? When our mental health is working normally, situations are assessed thoroughly. What aspects may be desirable, what aspects is not, and we look at it and we can then come to a conclusion. It's also flexible. If we go from one system, go to another system, you can change your mind.
Right.
So when it breaks down those 2 things, it gets rigid, it's not flexible, and it's just, as someone would say, one way. So that's the mental health system. It gives us wisdom, where the intellectual function gives us knowledge. And we all know that you can have knowledge without being wise.
Interesting.
So that's in a nutshell what the mental health system. It's not feelings. It's about thinking and beliefs.
So thank you for that, Dr. Kankam. And thank you once again, Esenam, for coming onto this platform to share your experience. Dr. Kankam, I want you to go over the 4 different types that you mentioned. It was optimistic, right?
Yes.
Regret.
Yes.
Danger.
Yes.
And the last one?
It's what we believe to be a challenge to our integrity. Like say somebody says something, you can imagine that what stands out in different cultures.
Right.
Some hand gestures, right?
Right.
From one culture to another can get somebody being very angry at you and you don't know why.
That is true.
Because they have attached certain, for example, a good example is I've been in this country for about 4 decades or more. Right. I still, when I'm giving something, I'm in a store and I'm giving something, handing something over. If I use my left hand, my brain still has it that it's an insult. Or if someone gives it to me with a left hand, it's an insult. When they don't mean that in this culture, but it's ingrained. So that's what, so the first thing is, why are you being rude? Because that's being rude. So these things are learned, but they can be unlearned. The normal we can challenge, look back and unlearn and learn new things. That's what makes it normal. It's not rigid.
Right. Interesting. Dr. Kankam, what is the connection between mental health and intelligence?
Sorry, mental health and what?
Intelligence.
Oh, as I said, so when we growing up, the intelligence comes first. It allows the child, that's to acquire knowledge.
Okay.
And those abilities range. I think we've all seen, or many people have seen, the video of Abra baby, the 2-year-old who has acquired more knowledge than even a professor. Okay.
Right.
But the difference is as much knowledge as he can spew out, the parents will not leave him alone to cross the street, because at 2 years he has not acquired these ability to know what is danger,
Right.
what is desirable. They don't. So we need the intelligence gives us knowledge, and we can build on knowledge to become, the professors, whatever we decide, the creative ones, but it doesn't guarantee us having wisdom. So one gives us knowledge, one gives us wisdom.
Interesting. Okay. So when we talk, before I go to this, when you're raising children, right? There's this scenario that comes up where some people believe, some schools of thought believe that when a child is doing something, right, that could be harmful to the child to a certain extent. Some believe don't stop the child, don't scream at the child. Some believe it's okay, just let the child be. The child will learn. On which side are you? Which school of thought are you? To leave the child and let the child learn, or maybe you are being too overprotective, so you come out and say, "Hey, stop! Don't do that." Does that affect the child in any way?
Okay, so the first thing is the awareness that how we interact with our children,
right?
Okay, makes a lasting impression in adulthood. Okay. Science is learning. Science is improving all the time and teaching us. Definitely in my childhood, at my age, parents there was no how to do.
Okay.
Now all this is on that. Be aware of what you say around the child. How it's not about do you not, it's how do you do it.
Okay.
Your goal, every parent's goal, is to raise their child to be able to be a stand-up person in the world. How to, it's not about punishment. I mean, when we were children, you know how it is. You're in school, you get something wrong, you get some lashes.
Right.
That's changed because of the knowledge. I don't think that the teachers meant to destroy people, but that's all they know. So it's not about should you leave the child. It's how do you get the child? How do you how do you direct the child in a way that they can learn what will be dangerous in future, but not harming them? It's the extremes that we all know that used to happen.
Interesting. So we're talking mental health today. When does mental health go wrong? Okay.
So one, any system, and I in my practice, I use the quote unquote physical health that people understand. I see that people get it, so I'm going to do the same.
Okay.
Every system in a body can go wrong. People understand you can have all kinds of cardiovascular diseases, not one. You have many respiratory diseases, not one. In the same way, mental health diseases. And why do the other systems go wrong? Many of the other systems go wrong because one, it could be genetic. Okay. You can have heart disease because it's in your gene. Or nothing happened, you don't know any family history, and it just happened. Every system goes wrong.
Right.
Or on the other hand, some things may happen. You may be exposed to some chemicals, and people have respiratory diseases, lung diseases. Right. In the same way, mental health diseases, it can be genetics. So if there is, the closer it is to you, like a child, a sister, a parent, okay, has a mental health disorder, you are born with an increased risk of having, maybe not the same. Again, I'm going to use diabetes.
Okay.
If you have a mother, father that has diabetes that needs insulin,
right,
you may develop one that not necessarily need insulin, but some part of sugar illness. So in the same way, so gene is one. The others are, you can, it can be chemical prescribed medications or non-prescribed drugs that people get, from the street.
right.
It can be medical, other medical disorders. Some people have stroke, other medical illnesses, or even medications that are used to treat other medical illnesses can cause some aspect of psychiatric illnesses, mental health illnesses. So it's a combination, but it's not all as when we're growing up, this person seem to have mental illness. It's not all about that. So think about it the same.
Interesting. Okay. So I'm in secondary school. This is a scenario. I'm in secondary school, and I hang out with friends. We start playing and smoking illegal substances. Okay, I start to have a problem. I'm talking incoherently. I'm behaving oddly. I'm not behaving in the normal way that I usually behave. Okay, but my parents think that it's probably somebody from my village that's casting a spell on me. So they take me to the church, to be prayed for. Is that what you would say? Is that what you would recommend? Is that the best way to go when something like that happens?
Well, again, my question will be, if that child starts having malaria or fever, are you going to take that same person to the church or the priest?
All right.
Hospitals are booming in Ghana, which means people are taking people to various hospitals for various health conditions.
Right.
Churches are booming. People are also going to church. So it's not either or. I say go to the experts, go to get your medical condition seen. Go to church and pray that the nurses and doctors who see your child or yourself, they are compassionate. They know what they're doing. If it's whatever treatment is recommended works. So it's not either or. It's this end.
Right.
But it's because the knowledge about mental health disorders came later than others.
Okay.
That's why in its, nature abounds vacuum. In its place, all the superstition is some old woman who didn't die and it's casting doing all this, or you didn't pray hard enough. And people still are taken to, again, we've probably seen pictures of
right.
People taken to spiritual camps. I mean, if it was okay, get your medicine or get your treatment and go to the priest and get treatment, that will be okay. But the inhumane treatment, because again, that's what they believe. So some of the shows like this is to help, that disabuse these belief system and say it is medical, just like other medical conditions. And no human being is immune from any medical condition.
Right.
Your degrees, the size of your bank account, it doesn't immune you from getting cancer, from getting diabetes, from getting any of the disorders arising from the dozen or so health systems in our body.
Right. So from what you've told us so far, I'm learning that all the myths and all the superstition is basically because we don't understand what we're dealing with. We don't connect it to a medical reason.
Yeah, you're right. You're right. And again, it's because science, the brain is a very complex organ.
Okay.
And it does controls so many things. And we still don't know everything about the brain. It's still but we know enough now to know that, these conditions are genetic. For example, when I was, as you know, I finished medical school in 1975, so yes. I'm not young. In those days, you don't see people coming in Kolebu with there was no mammogram. There was no coming. By the time people come with breast cancer, it is past anything that can be done.
Right.
But these days, with advocacy, with public education, people are now going to check. People self-check. It's all part of education, just like you're doing, advocacy.
Right.
So the more we know, if you know that you have a family history, your family history is not, as they say, it's not a life sentence. People who know that they have different kinds of cancer in their family, it allows you, what it does is it nudges you to, let me check up. If I have this, if I know that I have breast cancer in my family,
right.
If I feel a little knot, let me go to the doctor and check it out. Maybe nothing. But I want to check it out because also science is also developed that we have more things that we can manage diseases. So it's important to know, it's not to be terrified. Having an illness doesn't make anybody a bad person.
Right. Dr. Kankam, are there different types of mental health disorders?
Yes. So just like there are many types of cardiovascular system, respiratory system disorders, depending on what system. So the common ones, for example, each of the value or opinion that I said, in normal, when the system is working normally,
yes,
you see an aspect of a situation, you see what is desirable, what may not be, what may be angry, and your brain is going over it and saying, okay, maybe this, maybe this. Now, in some of the systems, some of the illnesses, it's rigid. For example, depression. People talk about depression. In depression, it's just like you only see through the lens of sadness, of everything being doom and gloom. So every situation, it's like the brain can see. I tell people, imagine that we have glasses that has, spectacals with 4 lenses.
Mustbe5radio.
Lens of joy, sadness, anger, what's the third one? Okay, fear, okay. And in depression, you can only see through the lens of everything is gloomy. Wow. It's not that you are choosing not to see the other. You can't. Illness makes us unable to. So that's what in those, and it goes with, if you see through that, life seems dull, you don't have much hope. and you say you're having a bout of depression. So each of this, you can also have a bout of fear, which you call anxiety disorders.
Okay.
But there are many. It can be fear of, one common one, which is often fear that people see you in some degrading fashion, which it's called social anxiety disorder. Okay. And this starts early in childhood. Your child is sitting in class. They know the answers, but they will never put their hand off because they're feeling like what I'm going to say seems like it would be stupid. They will laugh at me. This. Okay. And then there's fear of everything will be catastrophic. I'll be, if I'm in a car, I'll get an accident or something terrible will happen. So the different kinds of fears determine the different types of anxiety illnesses. And what is unique about anxiety illness is the person knows it. People come to us and say, Doctor, I know that I have money in the bank. I know I'm okay, but my mind keeps thinking I'm going to be out on the street. I feel like, that I'm going to be, it doesn't make sense. It doesn't make sense to the person, but they can't help it. So you saying to them, oh, why are you thinking like that? I just saw your bank account. It doesn't help. Know that they can't help it. Same thing with anger. Okay. When it forms an illness, it's a change from the usual. This is what we say. You know the person's usual. The person knows their usual.
Right.
And you get to a stage where it's different. Everything makes you angry because your brain is interpreting everything as a challenge, an insult. So you can't help yourself. Okay. There's anger. Even joy can have a bout of illness. Say if you are optimistic of everything, there is no risk in anything. Or I'm going to just stop work and travel.
Right.
I'm going to buy a car, and you haven't even looked at your bank account, finances.
Right.
So each of them. So you remember when I said when the mental health system is working, all all these four are working to look at this scenario. Which part of this? Let me look at this. Each of this can be rigid and not flexible. And so but because the feelings are that grip us, that's what we focus on. Oh, depression is all about feelings. No, it's about the thinking. Okay. And then there are others where the thinking is not logical. It's almost like it doesn't make sense. Those are what we call psychosis. Okay. And people only associate mental illness with those who experience that chronically, like the people you see on the street, anywhere in Ghana, you see on the street,
right.
They seem dirty. So that's one of many. Okay. Their brain can determine what is socially appropriate. Okay. So there are many, many, many different kinds that fill a whole book.
Interesting.
And I always say a book is not even enough for the variety of mental illnesses. So the message is that there's no mental illness. There are various mental illnesses. And even two people having the same diagnosis don't look the same. Two people having malaria still don't look the same.
Right. Interesting. You just opened up a can of worms because I thought when you talk about mental health diseases, maybe there was 3, 4, 5, but there's so many.
Mm-hmm.
Okay.
So many. And example, say, and I'm giving the common ones. You are in a depression episode. We say an episode about, just right. Like you can have let's say I'm going to, if you have let's say a bout of the flu, you, the same person, having the flu 2 months down the road, may not be the same exact symptoms you have. You may be coughing now. The next time it may be your body that is so achy. So the symptoms, you don't have all the symptoms, collection of symptoms at the same time. Okay. But we are, the experts, we train to know that a collection of this make this bout of an illness. But for you, you know the important thing that only you can know the changes in how your brain is assessing things and how your feeling is.
Right.
So if you wait for someone to see that now you are so withdrawn, now you're not going to work, you've waited too long. I am the first to know that where I can, I don't feel good now, but I know that soon I can tell myself, okay, I know this person loves me. I know I'll go here. I'll go. If I can begin to bring those to get me out, I'm the first person to know that. And if it goes on, and most of what we call a bout of illness, there's duration. It goes on for a while,
Right.
Okay, like a couple of weeks, and it either causes us great distress or impacts the way we function. What do we do function? Either we are relating to others, we're going to work, we enjoy certain things. If those things are being impacted, we are the first to know, I'm not feeling good. Let me go get help. And it also means that you, the person who is around, or your loved one, don't assume, okay, this person is not talking to me much or is not doing this. Maybe they're just bluffing. Maybe this. No, just remember, you can't read their mind. You can't know their feeling. But if you notice a change, ask, I've noticed this. Is there something you want to talk about? Very important.
Interesting. Esenam, we're not ignoring you. We'll come to you. We'll come to you shortly. We're just trying to.
I'm still on the line.
Okay.
Conversation.
Okay. We need to get into the mind of Dr. Kankam to pull out as much information as we can. Dr. Kankam, so a young man is walking the streets of Accra, as we have seen, for those of you who know what I'm talking about, shabbily dressed, incoherent, left home, and cannot even find the way back home. So straight away, we can assume that there's a mental situation going on, if that's the right way to say it. Okay, so does this person know there's something going wrong? Does this person know that, I'm not in the right place? And how can they find their way back home and be normal again?
That's why they say the brain is amazing. Again, we know when we have that mental health lenses,
right.
When we can. This person who doesn't normally roam the street or dress that way.
Mm-hmm.
Now, you, the stranger, is not going to know that they don't normally do that. But the people around, usually people, even if you live alone, you interact with others, if noticed.
Right.
Okay. Now, I'll give you, this actually happened within the past year, where someone, also a mental health, lived experience, now mental health advocate, saw this lady on the street of Accra. She said she was behaving abnormally, like I think the way she was dressed, the way she was talking to herself. But I don't know what courage got into this lady who was driving. And she got down, talked her into sitting in her car,
Right.
took her to the hospital, took her to a mental hospital. Long story short,
Mustbe5radio.
this lady was diagnosed with having an illness that can be managed. And I'll come back to that.
Okay.
She is now working. If you see the before and after, she's working, earning money, contributing to society, okay, and in treatment. Many of the illnesses we have in this world are what we call chronic illnesses. Hypertension is a chronic illness. Diabetes is a chronic illness. What does that mean? Many of the mental illnesses are chronic illnesses. Science hasn't come up with cure, but they can be managed so that you have fewer bouts. And if you start to have a bout, okay, that you be the first to know. In hypertension, if you keep checking your blood pressure, you know when it's up. Okay.
Right.
So those people, hopefully that when it started, it didn't just started. Their family members would have known to take them for help. But because of the stigma, the myths, the embarrassment, sometimes family members have to even hide the people at home.
Right.
Or take them because then for some people it means you are stigmatized. Especially say in a village, oh, this person is a witch, this person is this. So the more we know, the more we spread the word that no, these are medical conditions, the earlier. And then unfortunately, like any illness, some people have cancer. They get treatment, they are in remission. Other people get cancer, and unfortunately, it's severe and they don't make it. So every illness has a severity. But you want to have the chance, the opportunity for what modern science has.
Right.
And I want to emphasize that treatment is not always about medication. Okay, we call some holistic. I tell my patients, you can have the best doctor, the best counselor, see them every single day. You still have 22 hours in the world. And it's the people around you that support your faith, waiting for hope, whoever you serve, something. It's a whole lot of things, not just drugs, give you drugs, as some people see as psychiatry. All you do is give her drugs. No, that's not enough. But sometimes you need it. Just like you can't pray away your hypertension.
Right.
Sometimes you need medication and you need to take it every day. And if you stop, some people will say, oh, I stopped, nothing happened. Yeah, you stop your blood pressure medication, maybe a few weeks, nothing happens. Somebody stops there, 2 weeks later, they have a stroke.
Right.
Everybody is different. You want a chance to live your life in spite of a medical condition or medical conditions that you didn't call for.
Interesting. Listeners, if you just joined us, we're having a discussion about mental health, and we have the pleasure of talking to Dr. Jemima Kankam. She finished University of Ghana Medical School, Kolebu, in 1975. So she knows what she's talking about. She's a board-certified psychiatrist, University of Maryland Medical Systems. She's also medical director, outpatient behavior services, MedStar Harper Hospital, Baltimore, Maryland, and also a distinguished life fellow, American Psychiatric Association. Now, we also have Esenam Abra Drah with us. She's a mental health advocate. I'm going to come back to you, Dr. Kankam. There are different types, many types of mental health disorders, from what I'm learning from you.
Main types of what?
Mental health disorders.
Yes, like I said, we call some the common ones the mood disorders.
Okay.
Which is really not the correct name, like you said, because it's not about the mood. It's about the way the mind thinks. Like I said, you can have where you're only thinking like everything is going to be hopeless and helpless. That's the depression, and they have several kinds. One of the, and I'm going to focus on that, and I'll probably be a good time to bring Esenam in, because depression is one of those that, of the four emotions, the two that are painful are feeling down, sad, and feeling anxious. If I'm angry, it's not painful to me. The consequences is painful to the people that I'm interacting with, but anger is not a painful emotion.
Okay.
Joy, if I'm so joyful that I don't care about anything, it's not painful. It's, again, the consequences that are painful. So the main ones that are likely for people to stop them in their track and do something about or ask for help is the depressed mood and the anxious mood. Okay. But there are two sides to depression, or I should say there are two major illnesses in which you can experience depression. Depression means you experience it now, currently. We say you've had it for about 2 weeks or more. These changes where, your mood is sad. It goes with your thoughts that feel helpless and hopeless. And as it goes on, it's that helpless, hopeless. You can't see your usual hope. Even if you are a man of God, you are the one who quotes the Bible. Your brain can't go to it. And so you can't get where you get your faith from. And it's that sometimes for some people, it becomes, if I can't see hope, everything is gloomy, I might as well get myself out, which becomes the suicidal thoughts. Okay. So, but anybody who has depression can also experience another episode or bout in which the brain, everything is no problem. Even what should be a problem is no problem. And that it involves the two emotions that I said are not painful. Joy becomes excitable, over the bar, and anger becomes extreme for the person. Again, we are not comparing with anybody but us.
Right.
It's just like diabetes. I go back again. Two people can have low sugar. One may have low sugar and another time have high sugar. So the illness is diabetes. The other person has low sugar and never have high sugar. They're not called diabetic. And how you treat both are different.
Right.
In the same way, in depression, every time, and this is especially for us who treat, but it's good to advocate for yourself while you're being treated. If you are having depression and you go to see someone, if ever in your life you have had a period where either your everything seems angry making or everything is excitable, one may say, so what's wrong? What's the big deal about that? In those two, what happens is the brain doesn't have the space to think through consequences. So there's impulsivity, meaning you think you've done it. Mm-hmm. And I can tell you, at least I work in the U.S., many people are in jail who shouldn't be in jail because some of the behaviors were on impulse. They couldn't think through the consequences of the action. Right. Some people have done things they wouldn't do. Some people have behaved in sexual ways that they say that would never be me. That's important. It's not just you saying you shouldn't. They are saying that's not me. So anybody who has depression, we need to see, have you ever experienced? If you have, that's what we call bipolar illness. Okay. And then I've mentioned that there are others, the psychosis, which the brain seems to believe things that are not there or hearing things that are not there. And that's the one that typically people know schizophrenia. Okay. But let me also emphasize that anybody who experiences psychosis, now we know it doesn't automatically mean that you have schizophrenia, because every one of the mood condition can become so severe that you can experience that. So if somebody comes to the emergency room, they're hearing voices, they're screaming, you don't assume, because they may turn out they have depression that has become so severe. They may be using substance, there may be many things. So we have to explore what it is, not assume that anybody who has that. And then there's, we have to talk about substance chemical dependence.
Right.
There are people who, and again, this may not be as much in Ghana as here, but there are many people, young people especially, who use these substances because they are self-medicating. Just like many people will go to the store and get something to sleep. If you can't sleep, no matter who preaches to you, you know you have to sleep, you get your Benadryl or something.
Right.
In the same way, some people, unless we treat what they are trying to desperately get their thoughts some calmness, we can preach all we want. You can turn them to jail. They will. Because in my practice, I've been in psychiatric practice for over 3 decades.
Right.
I've learned to ask anybody who comes and is using substance, I say, what does it do for you? Because if I don't help them with what they are trying, some people who are drinking, they are drinking because they're anxious, and alcohol disinhibits, so it disinhibits your anxiety. So no matter what you do, if you don't explore them and help them with that, all the preaching won't go away.
Interesting. So many things to talk about when it comes to mental health. I'd like to go to Esenam. Now, you both have a relationship. You connected at some point. Esenam, tell us what was your story? Tell us your experience.
Okay, I hope you can hear me clearly.
Loud and clear.
Yeah. I just want to say I really appreciate the kind words Dr. Kankam spoke about me. I'm really grateful for everything she has done for me. And for me, my story began in 2015. I ended a relationship. It was a toxic relationship anyway, so it didn't matter whether he ended it or I ended it. The effects were still going to be the same.
Okay.
And at the time, I wouldn't say that I was emotionally stable, in the sense that I had built my world around this person, and for this person to no longer be in my life, it was a shock for me. It was like a stressor and a trigger at the same time.
Right.
And that time I was on campus, University of Ghana. I was in my second year.
Okay.
And I started getting depressed, but I did not know any symptom of depression. I thought when they say depression, it means you are sad. I did not know depression was also loss of interest in activities you once enjoyed. I didn't know. So when I was no longer feeling like bathing, attending lectures, eating, just sleeping for long hours, I thought, because of the heartbreak, that's why I'm feeling that way. Those are just the aftermath of broken heart. That broken heart is like a sickness. That's how you feel. That's what I was thinking. I didn't know I was actually depressed. So it started from March 2015 till June 2015. I had to come home. So all those months that I was depressed, a friend was supporting me through it all. And by the time I came home, now it was starting to feel like I was losing my mind. I was no longer in control of my mind, my body. I felt like I was going crazy. Like I felt crazy within. What I want to do, I will not do it. What I need to do, I won't do it. If, let's say, sometimes I'll be there and negative thoughts will come into my head. Why don't you just take off your clothes and run outside? And I don't want to do it, but what that voice is telling me feels like the right thing to do. So with this kind of behavior, at home, you can't hide what is really going on with you. So everybody in the house started noticing I was having trouble sleeping, and I would talk the whole night. What I'm saying to doesn't add up.
Right.
It started looking like it was a spiritual attack. And so we tried a few churches, moved to different churches. I was prayed for. Sometimes I feel better. Sometimes I don't feel better. It just gets worse. So after a while, my father just suggested that we should see a psychologist since we have tried the spiritual aspect. Thankfully, I didn't end up in any stage where I was restrained or tortured in any way. Mine didn't get to that point. But when we finally saw the psychologist, he was even thinking I had schizophrenia because of my symptoms. I felt like I was hearing voices.
Okay.
Those were the voices, and I was having suicidal thoughts, and I was having regrets. I was thinking maybe this life is not worth living anymore. If I die, maybe the people around me will feel bad for not being there for me when I was struggling. Since I just started looking like a nice offer on the table, the easy way out. And I wasn't seeing a life after my situation because it felt like I was losing my mind. I would have imaginations. I wouldn't say they are imaginations. Like they were like pictures and videos in my mind of my funeral and how people will file past my casket and people will say nice things about me. I just, it was like darkness. I couldn't help it. I did not want to think that way, but it kept on happening. And so the psychologist later on referred me to a psychiatrist, and I was diagnosed with bipolar disorder. And I wasn't happy about my diagnosis because I was looking at all my friends. No friend of mine has a mental health condition. Why should it happen to me?
To you.
Why should it?
Right.
I was thinking that this was like a curse. If I was thinking I have been faithful to God, I go to church, I give offerings, I serve Him. So if this thing should happen to me, or He should allow it to happen to me, why doesn't He allow it to happen to other people? I was just thinking, look, I have been very good from day one. Like, I don't deserve this. I felt it was a punishment. And I also did not have the understanding that this was something that could be managed. I wasn't thinking about the management part because my doctor kept on emphasizing that, oh, this is just like the way when you have malaria, you take medication, you are fine. And I just felt, no, it's not even about that. It's the label. So there's something wrong with me. And why is it that this should be happening to me at this crucial time in my life when I'm in my third year in the university? Please, I hope you can hear me.
Yes.
Yes, so I was thinking, why should this happen to me when I'm in my third year in the university? And so at home, that vacation, like the period of the vacation I was left, my parents made sure I was taking the medication. And I knew when I go back to school now, it was my life. I choose whether I would take the medication or not. And I didn't like how the medication was making me feel because when I started taking it, it will make me feel very drowsy, very tired. I was eating a lot. It felt like by taking the medication, it's overpowering me, and I'm allowing this condition to win. And a part of my faith also kicked in where I was like, no, I'm a Christian. Christians, we don't accept this. We are against it. We don't, you know how sometimes people can be very spiritual and tell you when you are sick, don't say you are sick. Say you are healed in the name of Jesus. Don't take this medicine. By taking it, it means you don't believe in God. All these things. So I was really confused and tired. And I also knew that I felt no, I could control the condition. Like it can't control me. So when I went back to campus, I started throwing my medication away. I wasn't taking it, and the symptoms became worse. So now I wasn't going for lectures. I was spending my money because it's bipolar disorder. So obviously, it's a two-in-one sickness. So I was swinging from the mania more of the time, and then the depression. So the mania is the highs, and the depression is the lows.
Okay.
I was spending my money. I was trying to redecorate my room on campus, where I was just spending 2 semesters in the room. But at the time, because the condition was affecting my thoughts, my sleep, my judgment, my priorities became misplaced. I wasn't thinking about school anymore. And so I started having arguments with people because I felt like I was right. Everybody is wrong. I am right. I am in charge. I was having grandiose ideas like I rule the world. I call the shots. I just felt like nobody understands me and everybody is against me. And so by the time the 2 semesters ended, I had failed 3 courses in my 3rd year because I wasn't going for the lectures. And when it was time for exams, I didn't seem to understand what was on the paper.
Right.
So that vacation, I knew I needed a new beginning. And so I told my parents I wanted to travel for a year abroad. Unfortunately, they couldn't afford France. So I decided that I'm going to go to Benin, which is, I don't mind doing fee paying, but I just wanted to leave the country. And thankfully, by God's grace, I had a scholarship from the government of Ghana.
Okay.
And I went to Benin and a fully paid scholarship. And that was when I decided that, look, Esenam, for 1 year, 2015 to 2016, you were not taking the medication. The symptoms got worse. It embarrassed you. You disgraced yourself. You were not stable. Everybody was talking about you. You became promiscuous. Like, I was like, no, I tried this no medication thing. It didn't work. Let me now try this medication thing my doctors have been preaching about. So I started taking the medication right from the first day I arrived in Benin, and I realized the quality of my sleep had changed. Like, it was like the old me, like how I used to sleep, and it was nice, so peaceful. I feel rested when I wake up. My thoughts were clear. I wasn't hearing voices. I could actually study and actually have good grades. I wasn't fighting with people anymore. And I realized that nobody even had to know that I had a condition. Apart from my 2 roommates, I told. Nobody knew. So I realized that, okay, so this thing is not as bad as I was thinking, that my life is over and it's a death sentence. So I did that. When I came back to Ghana, I was still taking the medication. And that's how, by God's grace, when I came back, I was able to resit the 3 courses I failed in addition to my final year courses. It was a really tough road, but God saw me through, and then I graduated from the University of Ghana. I did my national service. I got involved in some mental health projects, and I just decided that this is what I want to do. I want to be a mental health advocate full time. But it wasn't like that. When I finished, like, it didn't just end there. Like, everything was rosy. But in 2019, when I finished my national service in 2018, I was working as a French teacher. So a friend of mine was telling me that, look, if you want a full-time job after school with your condition, I think you should go and work somewhere where there will be no stress, like school. School has vacations, holidays. You don't have to work from 8 to 5. I was thinking, yeah, I even did where I did my national service. They really treated me well. They understood me. The stress was low. My headmistress really understood that, look, I have a condition, and so if some days I can't come to work, she understands. So I thought, that's how the real world is. Everybody's going to understand that you have a mental health condition, and if you need a break, they understood. I did not know the real world was different. So I went to teach at a school, and I knew for those 5 weeks I was there, the stress levels were high. I was commuting to school every day, back and forth, getting home late. And with our medication, the earlier you take it, the longer hours it will be in your system to work, and by morning it will be out. But if you're having short like hours of sleep. By morning, you still feel drowsy, tired, and all that. And so that's what was happening to me. I was getting worn out, and the medication wasn't working as effectively as it should. And things got so bad that I dozed off at two meetings, school meetings, and
Right.
one of the members of management asked me, "Oh, Esenam, what really is wrong with you?" And I opened up to her because I thought where we were teaching, we were teaching a curriculum that was teaching people to be open-minded, to accept people, to be empathetic, and all that. So I did not know I was going to get fired because I thought the owner of the school had spent some time outside the country where mental health is well known more than this place. So if anybody should stigmatize me, not here. But unfortunately, less than 24 hours after I opened up to this person, I was called for a meeting and I was told to share my story. And I thought these people cared. So I shared my story, what happened, and I got here. I told them everything. I told them I was on medication, I was managing it. But the school counselor who was asked to give his opinion said, because I have bipolar disorder, I am not supposed to be working with children. I am violent and dangerous and all that. And I was told that was my last day of work. So that first-hand experience with stigma made me realize that, look, because I was like an undercover mental health advocate for a year. I hadn't gone public yet. But after I was stigmatized, I realized, look, there's no need to hide anymore. I'm not saying that the condition is me, but I realize this is something I should talk about. I don't like the fact that I have to live with this, but I can do something to change the way people think about mental health and stigma and all that. So that's what made me start my YouTube channel, and then that's what I've enjoyed doing since then, creating content on mental health and disability, and also making people in the faith understand that when somebody says they have a condition, we also have to understand that just like the way pastors don't find anything wrong with going to see a doctor about malaria, headache, or anything, you should also not find anything wrong with someone trying to seek professional help. You should even encourage it, because I feel like if I had been taught in my curriculum from childhood about mental health, when I was depressed, I should have known that what was happening to me was a mental health crisis. I didn't know. So I feel like this is an opportunity to talk more about my experience, because the World Health Organization estimates that 1 in 4 people experience a mental health condition in their lifetime. It's not a curse or anything. It's just because sometimes life gets hard. Even good things can trigger a mental illness. Bad things can also trigger it. So we should just know and learn how to take care of our mental health, and know how to also realize when somebody is going through a problem, because some people will never seek help or open up to anyone. They struggle to do that. It's just how sometimes how we were brought up and all that also seems to affect us. So that's just a little
in a nutshell, right? Thank you so much, Esenam. So I have a question for you. At the time when this situation started, right? Those close to you, for instance, your immediate family, and then also your roommates, did they notice anything?
Well, for my roommates, I think they noticed something. But you see, sometimes we just think some of these things are spiritual. And what was happening to me was that when I was going through what I was going, like when I was going through the symptoms and all that, sometimes I would just pack. I'll not even pack. I'll just tell them I'm going home. So when I come home, then maybe my mommy would take me to church or something. So we all thought I was under some spiritual attack, because it looked like I was at the height of my educational ladder, and of course, who wouldn't want to attack me at such a strategic time? So they knew something was wrong. I knew something was wrong. But what else could it be? All we've ever known was if somebody is doing well and things start to go wrong,
Then it's
obviously
it's the village people, right?
yes, yes, and it's the devil who is just seeking to destroy. And everybody's knowledge about mental health was very little at the time.
Right.
5 years ago, mental health wasn't very widely spoken about in Ghana. So my roommates, they were also as confused as I was. My family also did not know what to think. Nobody knew what was going on because I actually went to hospital, like to do my blood work, labs, and everything looks fine. So what what could it be again? So obviously everybody was thinking, no, it's obviously spiritual.
Right.
Someone is trying to
Right.
do me.
Okay.
So that was what happened.
Thank you for that. We're discussing mental health, and we have Dr. Jemima Kankam and Esenam sharing expertise and experience right here on Mustbe5radio. I'm going to go back to Dr. Kankam. We've talked about a few things. We've talked about mood disorders. We've talked about anxiety disorders, personality disorders, psychotic disorders such as schizophrenia. What are the symptoms? What are there any basic symptoms that you look out for when you have a patient come to you or when you're talking to someone, Dr. Kankam?
Okay, so that's a very good question because we, like Esenam said, if you don't understand what's going on, if you don't determine that certain changes you're going through may be medical, why would you even seek any medical person? Why would you go to see a doctor? You all go to see a doctor because either you having distress, pain or fever or something that you know about. Okay. Now, most people, even here in the US, most people with mental health symptoms see their primary care physicians. Why so? Let me go back to when I said about describe the normal health system. You say you have the opinions formed, you have the feelings, and then you have the physical reaction to them.
Right.
So when Esenam said when she was, when you're depressed, there can be changes in physical conditions like your sleep pattern. Everybody knows their pattern. The pattern is different. You tend to sleep a lot more when you are depressed. You are just withdrawn, or your appetite changes. Okay, so the physical things are the changes that the people go to a doctor to complain about. Okay, I haven't been eating. I have lost weight. I don't have energy. Unfortunately, the whole world, medical training does not give adequate focus on mental illnesses. And so it's more likely, you get the focus is on those physical conditions, just like, she was sent for blood work, which was the right thing to do, but everything is okay.
All right.
There's nothing wrong with you. No, there's nothing wrong. Those things that the blood work can identify, there's nothing wrong. But the medical clinicians also have to be trained to know that if someone is not eating or changing these physical changes, one of the conditions that can also explain it is a mental health condition. So if somebody comes to any doctor, any nurse, I have these changes, it's been going on, you want to ask them, what about, has there been any changes in the way your mind is thinking? The usual way you're thinking, you feel hopeful, have there been any changes? And the person can say, because when people go to their general doctors, as they call it, they are real doctors.
Right.
They don't want to bother them with what they think is not, it's not under, their purview. My real doctor doesn't want to hear about my feelings. No. So one of the advantages of understanding, I tell people, if they don't ask you, tell them. I have this physical, but at the same time, my thoughts have been feeling like Esenam described. Don't want to do anything. I don't feel like bathing. I don't feel like doing anything. And then, my feelings, my usual feelings, where I can have the normal 4 range. I can be happy. I can be sad. I'm only sad. So those 3 areas, it's like if you give all, you've helped yourself by letting the doctor think, oh, okay, this might be this. Because even here, people don't come straight to the psychiatrist because of stigma. Okay. Mm-hmm. 2, there will never be the whole world. There will never be enough psychiatrists to go around people who need psychiatrists. It's not possible everywhere. Okay. So my advocacy is every doctor should know, every trainee should know that all this, just like we are trained, it doesn't matter what specialty you go to. By the time you finish medical school, you know what diabetes is, what hypertension is, what this, you can do the basics. But in advocating for yourself, once you know that these changes are occurring, make sure you give as much information as possible, because the majority of symptoms nobody can see. Nobody can see my thinking. Nobody can see my feeling. And not everybody cries when they are sad. So you may not even know. So people hear of someone, attempted suicide or died of suicide, but they were just at work. We can go to work. I can talk myself into doing something that I'm not interested in doing. You slap your pancake on your face, you put your makeup on, and you go. Nobody will know how you're feeling. So I can't hammer it enough that only you are the first to know.
Right.
And that's where the awareness comes in.
Interesting.
I want to focus on something that Esenam said.
Yes.
And which people say about medications. Okay. So medications, not just mental health, medications to treat mental health disorders. But if my medication is making me tired, I can't work. Treatment shouldn't be just as bad as the illness. Speak up. Tell the doctor, no, this is making me feel this way, because the good news about modern day science is that for any illness, whether it's hypertension, asthma, there are so many medications now than it used to be. When I was living in Ghana, there were probably 1 or 2 medications for mental health treatment.
Right.
Even here, until the 90s, for depression, there are probably about four medications. Now the sky is the limit. But every medication has its effects, its side effects. Every medication in the world has side effects. Right. So some may make you more drowsy, but you can get the others that won't. So don't accept the side effect as, oh, okay,
as a norm.
That I have. There is, it's 2023. There are options.
Okay. Dr. Kankam, Esenam's case, she went from an unfortunate situation of love gone bad, right, and then to depression, right?
Sorry, I didn't hear you.
I'm saying, with regard to Esenam's case, she went through a love gone bad situation, and then that triggered the depression, right? What is that thin line between her being happy in a relationship, everything is going on, and then all of a sudden the depression sets in? What's that thin line? What triggers that?
So, as I mentioned, that there can be stress.
Okay, stress.
That stress can, just like people know, stress can trigger high blood pressure.
Right.
But sometimes it's triggering something that we already had a risk of having.
I see.
So what is stress? Things happen, and how we form opinion, how we see it affect us, determine what is stress and what is stressful to us or not.
Okay.
So two people may be in the same situation. One may not be as stressed because the way they see it in their mind's eye may be different. She explained that she built her whole world around this relationship,
Right.
And so when the relationship was not there, her assessment of it was, I'm nothing without. And this happens. I mean, this happens a lot. It's written about in terms of nobody can make us feel any way, So whether she already had a predisposition, a risk of having this illness, the stress brought it about. Just like sometimes some women haven't been diagnosed with diabetes, and then when they are pregnant, their blood sugar goes and they say pre-diabetic. Some of them may have had family history or predisposition to having it.
Okay.
But pregnancy brought it about. So some illnesses can come on its own. Something stressful, something that our mental health system trying to cope, it just overwhelms us. Okay. And then you get an episode. And she talked about, so for her, she became depressed. But because her actual, she got into a depression bout or episode, as we call it. But because her actual illness, in which the depression is about, is bipolar disorder, she went from being sad to being the person now who everything seems like, as I said, a challenge to her integrity.
Right.
Or excitement, no problem, spend money, decorate, do this, everything. So she went into her mind, those two lenses being the only thing that is seen. And so it became a yo-yo. And she also, it's an example of what I said. By the time it got severe, her mind was not in touch with reality.
Right.
Okay? But because, and again, this was 5-7 years ago, hopefully, we are all learning to, to really look through and ask questions, not just about the here and now. And I'm talking about those of us who see patients, but to look at the past. If the doctor said, oh, it started with depression, and now, look at where you are. They should see that this swing is in this family of illnesses. So this is an example of what I would say. If you took your family member, your loved one, to a doctor at the point where she said she was not in touch with reality and all that was happening, whether the doctor asked you or not, say, but it started with this. It started where I was very depressed. This happened. So I call it, we diagnose, or we should be diagnosing not based on a snapshot, based on the video of our life. Because some people come,
Mustbe5radio.
they are depressed now, they're in their 30s. So they come now. As you ask, when I was in college or in my teens, I went through a bout of this, and a few years ago, I went through a bout. It is that pattern that we are trained
I'm looking for.
to base diagnosis on.
Okay.
So
Okay.
if you just go and I'm not feeling this way, and the doctor know that, no, you're not getting the whole help.
Interesting.
So that's my advocacy. Give
Right.
the whole picture.
Okay. I'll take a few questions from the listeners. This question, does the use of opioids or illegal drugs like marijuana or cocaine cause mental illness?
Yes, in some people it can. Just like I said, that some chemicals, even the one prescribed, can cause it. But we, the clinicians, also should know that it may be two things happening at the same time, may not be the cause. It can be, for some people, is that impulsivity. I'm going to try experiment with this. Okay. At a time when you are not thinking through. For some people too, and again, I work in the US. I've seen many young people. It's when they went for dental workup, got pain medicine by opiate, then they see that, oh, I'm calmer than I used to be. I'm something seems better. They keep taking, and these medication are addicting medications. And I make clear, it's not a person that makes a medication addicting. There are chemicals that if you take it long enough, your body sees it as part of its own. So if you stop, you have some very uncomfortable effects that you find that you have a drive to go and take it.
Right.
So yes, it can. So the answer is it can, or it can be a sign of the person trying to do something to help themselves.
Right.
Or they took it and they got addicted, so they got another problem with it. And we've had a lot of the opiates. There are many kinds of opiates. Back in the 80s, where I worked in inner city Baltimore, it was heroin. It wasn't killing people as much as the new ones, the fentanyl that had been killing thousands of people. So we didn't hear much of it. And it was considered, the poor people. Now it's in everybody's door. So just because somebody is using, please, for us, the treaters, for family, don't assume what else could be going on. And back in the 80s and 90s, the chemical dependency, we used to call it substance abuse, treatment places, and the mental health fields, we didn't talk to each other. I would have a patient, or we would tell patient, if you continue using, I won't treat you. And the substance abuse place will say, if you're on medication, it won't take you because medication is still a chemical. Now, both sides have seen that we're wrong. We need each other. So if you go to a chemical dependency rehab now, they will have a mental health clinician still take your history, see if there's any mental health condition. We also know that some people can't stop using unless we treat what they are trying to treat. So it's, we're working together.
Dr. Kankam, it appears we might have to bring you back a second time because we have so many questions and this topic is really in depth. I'll pick another question from a listener, maybe two or three more questions. So in certain parts of the world where caning is common, it's not common here in the US, but in certain parts of the world where caning is common and acceptable as a a form of correcting a child. Can this form of discipline affect a child mentally?
Well, I think I don't know the caller, how old they are, but some in our age group know that, as we say, you get caned at home and your parent goes to school and tell the teacher and you get a second caning, all in the name of trying to get you good. We know that there are other ways to correct a child or direct a child. And as much as we make excuses and praise our parents, we know that some things could be better. Many people, it didn't matter, that they were able to escape the psychological effects, just like people go to war. Not every soldier comes back and they have trauma, but everybody is at risk for trauma.
So in this case, it's a teenager.
Excuse me?
In this case, it's a teenager.
Well, so this must be in Ghana, because the teenagers here, you will see the social workers at your doorstep.
The next minute, right?
You will see the social workers at your doorstep.
Right.
Even, excuse me, from what I read sometimes on the social media in Ghana,
yes,
from people in Ghana, they are opening up and saying, "Is this necessary?"
Right.
So there are more ways. Yes, you do. No parent wants to subject their child to trauma. And as people talk about the effect it has on them, parents are listening. It's not saying don't punish the child. There are different ways of punishing, like withhold. If you've bought that smartphone for the child and they are not listening, get your phone back for maybe a month until they shape up. So there are things, or reward them for when they are doing something right. Everything is not caned, because we know in secondary schools, some people who were caned, it didn't matter. It didn't make any difference. It just got hardened.
Right. Thank you.
But by the way, Ghana, we also have the DOVSU. I think Esenam can tell me, Department of, what's DOVSU? Esenam.
I think victim
Department of
support.
the violence or something. So even in Ghana, they can call them and they will show up at your doorstep.
I see. And this is in Ghana, right? Let me see.
Even in Ghana, yeah. So even in developing countries, with the internet, the world everybody is reading that. Is it necessary? There are ways of redirecting.
Right.
That is not always corporal punishments.
Okay. I believe DOVSU is Domestic Violence and Victims Support Unit.
Yes.
That is in Ghana. Okay.
Yes.
Interesting. Dr. Kankam.
I don't want us to leave without talking about suicide. Which,
yes.
Because suicide is, I know probably most of the audience are, connected one way or another to Ghana. And when I came here, I used to say, suicide, we don't have that in Ghana. No, the suicide rate in Ghana is going up. Suicide is when the mind gets to the point, as Esenam said, it can see hope. Hope is what makes all of us, no matter what is going on, you get up and say, hopefully today, something will be better. We take it for granted because that's how our mental health system is built. Our body health system is built to work well until it doesn't. So if you have an illness where you can't see hope, what will make you get up and go to work or get up and bathe? So you get to a point, you think people who people who have died, we can interview them. People who have got to that brink, as Esenam said, you ask them, that's what they believe, that maybe if I'm not around, everybody is better off.
Right.
These are the thinking that is not their usual way of thinking. But right now, that's how their mind is locked in. And it goes from, sometimes people have death wishes. I wish I was dead. That's not suicide, but that's the beginning. So if we have something called suicide risk assessment, like if I see someone and they say that it's not enough, I have to go through the process of going through, have you thought about it? Have you had, do you have access? What has made you not give into it? We call that mitigating factors, the factors that will make you hold.
Okay.
For example, someone said, I'm a Catholic and I know that if I did that, I won't go to heaven. It doesn't matter what I believe. I want to help that person. So I keep helping, reminding them, so it's very important to take it seriously.
Right.
Because in the past you say, if you really believed it, why haven't you thought about it? The human being wants to live. It's that sometimes the brain gets to a point where it cannot see that hope.
Right. Okay.
In the US, you can call 988 suicide hotline.
Okay.
If, and someone will talk with you.
Can you say that number again?
988.
Okay, 988 suicide hotline.
Anytime, 24 hours.
Okay.
I'm sure other places have.
Okay. Kankam and Esenam, and then we'll wrap it up. So my final question for today, we have to come back next week and then talk some more. Are all persons with mental illness dangerous to you, Dr. Kankam?
So the answer is no. There are times when having a certain mindset, okay? So and there are various mental illness that will make us, at some point when it's acute, make us not able to think about the consequences of our action. So, for example, if you're in angry mode, and then your mind is not able to think of the consequences. Somebody makes you angry. You have something, a knife, an object you throw. Okay. It's not that normal. At that point, you are not able to think about the consequences and things happen. Now, in a place like the US where everybody has a weapon, some of the behavior might cause death of others.
Okay.
So it is not, even for those, it's not that the illness itself, but the point, at that point where you are in danger, your mind is not able to, because remember, the normal mental health, where everybody has a mental health, a health system, is normal until it gets to a point where it's not. We think about the consequences. And that makes us do something or not do something. So the answer is no. In fact, many times it puts people in danger, because even mania that she talked about, that, you're doing things, you're not thinking about the consequences. Many people do know that in depression, it can cause your mind to feel like life is hopeless.
Right.
And people harm themselves. In mania, people put themselves in harm's way, not because they want to, but the brain can make good judgment. So sometimes people will confront someone that normally they will stay away from and put themselves in danger. I've had people say, I can't believe it, Dr. Kankam, that it was 2 a.m. and I stopped my car and I was arguing with this person. I would never do that. So that answer. So that's one of those myths that, everybody who has a mental illness is dangerous. Actually, they are more vulnerable than being a danger to others.
Right. Thank you so much. Thank you so much, Dr. Jemima Kankam from University of Ghana Medical School, Kolebu, 1975. Also, board certified psychiatrist, University of Maryland Medical Systems. She's also medical director, outpatient behavior services, MedStar Harbor Hospital in Maryland, a distinguished life fellow, American Psychiatric Association. And also we spoke with Esenam Abra Drah, who shared some of her experiences. She's a mental health advocate. We ran out of time for today, but the two lovely ladies are willing to come back next week, Sunday, so that we can do a part 2 of this chat, of this conversation. Final words, Esenam, for today. We'll be back again next week, but do you have anything to share for today, Esenam?
Oh, okay. I'll just like to encourage everybody to learn more about mental health. Don't say that, you've heard enough, you know enough, you've read enough. Try and learn more and take advantage of every opportunity to listen to every conversation about mental health. You always learn something, and then know that maybe you are not learning for just yourself. Maybe it could be for someone in the future. So it's very important that you arm yourself with this knowledge. And everybody who came to listen this week should invite others to come and listen next week too.
Thank you. And Dr. Kankam, your final words for today.
Thank you all for coming. I hear there are many questions. I would love to answer the questions and even learn. It's not always answering. I have learned more from my patients in the last 3 decades. That's what makes me an advocate. You know, it's not just from the textbook. So I appreciate. Come back next week. Let's talk about it. As Esenam said, it's not just about you. It's about your family, your loved ones. Intelligence alone doesn't make it. We need our emotional health to make it in life. So thank you very much.
Thank you so much. I really appreciate the time. And we estimated an hour tops, hour and a half, but there's so much to talk about. There's so much to discuss, and our listeners are eager to understand more. So thank you for accepting to come back next week, and have a wonderful Sunday.